quite late in the evening, and we are really thrilled that we've got so many people that have turned up. We had over 200 people register, which is a fantastic number. So welcome to you all, whether you're watching live or whether you're watching on catch up on our YouTube channel. So I'd like to start off by thanking the HMSA for kind of co-hosting this webinar with us during Awareness Month, Dysautonomia Awareness Month, and with PoTS Awareness Day fast approaching on the 25th. My name's Jo Bullingham. I'm the General Manager for PoTS UK. And if it's all right, we'll just do a quick round robin and introduce ourselves. And if you just say your name and a little bit about your role, that would be fantastic. So starting with Lisa.
Hi, I'm Lisa from the HMSA, and thanks very much to PoTS UK for having us this evening.
Philip.
Hi, I'm Philip Bull. I'm a recently retired consultant rheumatologist. Very pleased to be here.
Lovely to have you. Kim?
Hi, yes, I'm Kim Clayden with the HMSA. I'm the Professional Education Coordinator, supporting events like this and training professionals about these conditions.
Brilliant, thank you. And Helen?
Hi, I'm Helen Eftekhari. I'm a nurse advisor to PoTS UK, and I've been running a PoTS clinic for about 10 years now.
Brilliant. And then I don't know, Linkferry, if you want to unmute yourself or if somebody from your team introduces you.
Don't know if they would.
We've got Linkferry on the call who will try and put helpful links as they come up in the chat as we go along. Thank you, Linkferry.
Yeah, I mean, everyone should have a Linkferry. So yeah, welcome to you all and thank you. I've just seen on the chat box, we've got somebody from Queensland in Australia, and it's 4:30 a.m. on Wednesday morning. So I reckon top marks to that person. That is dedication. So a very warm welcome to you as well. So the session tonight, we are going to have a very brief introduction into what PoTS is and what hypermobility syndromes are. This is just going to be a very whistle-stop tour, just to go through the basics for anyone that is completely new to it. We're then going to have a discussion around the link between the two. As I think, that's probably what's drawn you to the webinar this evening. And then there'll be an opportunity for people to ask questions. It would be really helpful if you could try and put them into the Q&A box rather than the chat box, so that we can keep track of them all there. That would be absolutely fantastic. And then what we'll do is we will try and pick out the questions that are the most popular ones that we're seeing time and time again. We know from experience that sometimes we get inundated and we don't get through them. So if we don't, we will do our best after the session to group them together and get some answers to you. As always, we can't answer specific questions to your personal situation. So if you can try and keep your questions as broad as possible so that they can benefit the wider group, then that would be really fab. And then finally, if we have time, we would really love to just update you about how the two charities can support you and just our latest news, really. It's always nice to have the opportunity to do that, but we're conscious that the main reason is for you to be here is, to learn more about hypermobility syndromes, PoTS, and the link between the two. So we will absolutely pay most attention to that. And if we don't get round to doing that, we'll send an email update to everybody who's registered, so that you can find out a bit more about us or follow our YouTube, our social media platforms. Have I missed anything there? Anything before we move on? No. Fab. All right then. Well, I will hand over now to Dr. Helen Eftekhari, and thank you very much, Helen. I'm going to stop sharing.
Thank you, Jo. I'm very pleased to be part of this webinar and to see everybody here today. So the way I think you need to understand PoTS is to understand that's part of the wider part of autonomic dysfunction. And to give a very brief overview, the autonomic nervous system is a nervous system that we all have as human beings, and it's responsible for controlling those parts of our body that we never think about. So, for instance, it controls digestion because we never sit there and think about how food moves through our gut. It controls our bladder. We never sit there and think about collecting urine in our bladder and filtering out the fluids that we take in. We never think about temperature control. We don't tell our body to sweat when we get hot or to get prickly, goosebumps when we're cold. And when it comes to PoTS, we look at that as part of the cardiovascular autonomic nervous system. And cardiovascular basically means the pulse and blood pressure. So we don't sit there and automatically think about how to control our heart rates and blood pressures. We don't tell them what to do. That's our automatic nervous system at the background. And PoTS stands for postural, which is standing up, orthostatic, which means our body's ability to adjust to standing up, tachycardia, fast heartbeat syndrome. So in PoTS, what you look at in cardiovascular autonomic function, we're looking at how our blood pressure and heart rates are controlled when we go from, say, a lying position to sitting position and then standing up. And there'll always be some slight variations to this, but in PoTS, another sort of conditions along this spectrum of disorders is you'll actually get an exaggerated, really abnormal response to standing up. And a lot of it is to do with the way fluid shifts through the body. That's why we talk a lot about lifestyle measures to control PoTS, because we know that, like, sort of when people are standing up, you should have responses and receptors within the blood vessels and in the peripherals that should tighten up to keep blood volume in the center of the body. You only need to lose 200 or 300 milliliters of fluid from the brain to make you faint, which isn't a lot, and start feeling dizzy. You don't need to have much of a shift, and that's because in conditions of PoTS and the other, the other areas that we can talk about maybe a bit later, you're getting that blood pooling as such within the peripheries. We can get a whole number of different symptoms with PoTS from, and I certainly won't hit all of them, but dizziness, palpitation, lightheadedness. You don't have to faint. A lot of people don't faint. You can just feel generally unwell, fatigue, tiredness, a whole conundrum of different symptoms people present with. We also know PoTS is about, in clinical practice, I'd say about 80 to 90%, and this is mirrored in the research studies as well, are women. And generally, we see a lot of younger women coming through our clinics. And I think I'll leave it at that there. And then that probably is a nice segue into joint hypermobilities. And we can talk about anything else, and I can go into further explanations later.
Fantastic. Thank you. And I'll hand over now to Lisa.
That's great, thank you. And actually, I'm going to hand over to Kim, because just before we get started, we just wanted to do a quick Slido survey just to see on the call who is affected by symptomatic hypermobility, who's affected by PoTS, and who's affected by both. So I think if you can either use your phone to do the QR code, or if you go to slido.com and put in that number, it would be great if we could just quickly see now who we've got on the call and how they're affected by either PoTS, hypermobility, or both.
Yeah,
So,
that's why it was written in my
go.
words, what's going on with you? So basically, what you got going on, and it'd be really nice to kind of get you guys to be a little involved with this. So you can use your camera, and you can hold on your phone or any smart device with a camera and hold it up to the QR code, and it should send you straight to this. So you can put in if you're hypermobile, PoTS, or you got both, or you're not, you don't have any sort of symptomatic stuff going on, but you're hypermobile in some shape or form. And if you don't have access to that, if you're on a PC right now, like I am, you can go on to, you just type in your browser slido.com, and then you put that number in 1382474, and you can join us that way as well. And I'm loving the fact we've got, I think, 44 people going right now joining us, and it's very, very interesting, and it's just how I thought it might play out, that there's both. A lot of people have got both going on, because it's very, very common in our bendy community to see this. So this is fabulous. Still more people voting.
No, that's
Excellent.
great.
This is
And I'm
cool.
sure none of us are surprised that number one is winning. So That's great.
Absolutely. So we can keep that open, so that poll will just stay live. Lisa, did you want to, should we go on to the
Yeah, shall we move
slide
on?
now
Because
for
I
you?
think it's kind of conclusive, isn't it? And we've got 60 responses. So thank you to everyone for that. That's super interesting. So we're just going to run really quickly through these slides. We know people want to get to the Q&A, so I'm just going to zip through this. So the HMSA is all about supporting people with symptomatic hypermobility, and hypermobility is not uncommon. About 1 in 10 people are hypermobile, but for a smaller number of people, they have significant symptoms. And I think one of the things we like to stress is that whilst we absolutely support people with HSD, with Ehlers-Danlos, EDS, whatever, there are many more conditions and syndromes that are connected to hypermobility, including Marfan syndrome, Stickler syndrome, OI, and also it can be joint shape, looser ligament, poor muscle tone, and other conditions such as Down syndrome and cerebral palsy. So we just like to give a voice to people affected by those conditions as well. Sorry, Kim, next slide, please. That's great. So this is just a really nice Venn diagram that clarifies that, and it just kind of shows the spread and the range in terms of how people are affected. Because this is being recorded and people can watch it afterwards, I'm going to zip on to the next slide. So again, this is just going through some of the hypermobility syndromes, but what we'd really like to stress, and Philip, I'm sure, could add to this, is that there are many, many more. It's not, it's a very, very complex picture. But actually, the interesting thing is that for most of the forms of symptomatic hypermobility, unless someone has a very specific condition like vascular EDS, in many cases, many of the self-management things that one can do on a day-to-day basis to support oneself are very similar. So a lot of what we do at the HMSA is supporting people in terms of pacing, lifestyle things alongside clinical care to help people sort of have a better quality of life. Next slide, please, Kim. So we'll, I'm sure, cover a lot of these things this evening, but there are, I think when people talk about hypermobility, they sometimes just think about flexible joints. But as you can see here, there is a long list of things that may co-occur with hypermobility, including, of course, autonomic dysfunction and PoTS. And I just wanted to share again some really great research that's been done, the spider screening tool, which I'm sure lots of you might be familiar with. But I think this has been really groundbreaking in terms of looking at hypermobility and its effects as a whole body condition rather than focusing on one element, because I think a lot of us know that we go to the GP or the doctor or the specialist for one specific condition, but this is a really great screening tool that came from James Simmons and her team out of UCL and Great Ormond Street, which looks at it in a much more holistic way. And this is actually a great thing to share with clinicians if you get in front of them. So, and that's just kind of showing how it can be mapped. But I just wanted to share that because I think it's a really good way of looking at the overlap between so many of the conditions, which is really relevant for us all tonight. And now I think back to Helen.
Which part am I doing?
So Helen, we're just now we're going to talk about the link between hypermobility and PoTS. And obviously, if you want to bring in any of the other speakers at this point, or if any of the other speakers would like to jump in, then that would be wonderful, and just have a bit of a discussion around it.
Brilliant.
Yeah, absolutely.
What do we know,
slides
basically?
that we can share or not share, so up to you.
Yeah. So I think from the research studies, we know that there's an association between the joint hypermobility syndromes and PoTS, and it's for the reasons that Lisa's just outlined. From my understanding of it, it's a lot to do with how the nerve fibers interact within the tissues. and then how the responses come through the nerve fibers in terms of controlling from the perspective of PoTS, heart rate responses and blood pressure responses to standing up. So I don't know, Philip, you're a rheumatologist. Is that your understanding of the links between PoTS and joint hypermobility?
Well, from the joint point of view, it's a lot to do with collagen flexibility and the fascia and that sort of thing. But it affects all sorts of tissues throughout the body, the neurological system and things. So, you know, it's a question of really one of the messages we're trying to get across is to identify the key symptoms and the key signs, which we'll come back to with the quick reference guide to, which we've put forward later.
Yeah.
But
Shall I just pop my slides up
Yeah,
then? 'Cause
I
it's
was
got
going
all
to
of
say,
these little
Kim,
bits of info
yeah,
on.
exactly. Kim's done some really helpful slides, but it might just be helpful to.
yeah, Kim, if we could have the quick reference guide, maybe, or do you want to
That's
go?
on it. It's got its own slide. Don't you
Yeah, I
worry,
know,
Phil.
I know.
Right, hang on. You're all getting ahead of me now. So
While Kim's
share,
doing that,
share,
just to say, we have got a quick reference guide which was designed for primary
Yes.
care clinicians, but we will happily share it with anyone so that you can use it, take to appointments, etc.
Okay, so I was unaware that our beautiful link fairy was going to be here, so I could have sent the research papers that I had found for this, and I apologise to Link Fairy in advance, but they are amazing, and I'm sure maybe they could find it for me. But one of the surveys that there was done showed that 31% of people that have PoTS also have hypermobile Ehlers-Danlos syndrome, and 55% meet the criteria for hypermobility in itself. So they have, in essence, generalized hypermobility. Now, the main link that we tend to see, and I see within my private practice, is it's the connective tissue laxity, as Phil was very kindly saying. So in hypermobility, it's not just the joints, it is the connective tissues, it is the collagen that is faulty. So it affects everything, practically everything's got collagen in it. So it will also be blood vessels. So then we think about, you know, that stretchiness. I've got the all my words I'm making up tonight. The vein stretching, artery stretch, have a little bit of stretch to them. All of these things have got an element of movement and stretch to them. So when we're standing up, or even as I sit here and you know, I'm sitting working on my laptop, my blood will pool. So that's what we mean by excessive venous pooling. Especially when standing, it's definitely going down the feet. So it is not then pumping back up particularly well because of that stretchiness of our system. And so I sit here, and after about an hour, I can feel it. If I'm not jigging my feet enough and wriggling my feet enough, I even get wiggly, the screen start to wiggle, and I can, you know, the words start to wiggle because the blood's just draining from me. So I'm jigging most of the time when I'm sitting at working on laptops and things, but that's what we kind of mean by the venous pooling. And when we're standing, it's extra hard for us to maintain that blood pressure and that circulation because of the stretchiness, and it's just then pooling down even further right into our tippy toes. So it just causes this problem with us being able to maintain that circulation really nicely, and then we get a lot of lightheadedness as a result of it. And that's exactly what Helen said. You know, it's actually not, there's this real misconception that PoTS must mean you must faint. Not at all. My mum was the fainter, not me so much. But it absolutely is in our family, and I could see exactly like what was going on with her as well. But hypermobility affects, as I say, the connective tissue throughout the body, and it includes that vascular system, the gastrointestinal system, and it relies on the structural integrity of that autonomic system as well. And not to forget that chronic pain and instability and hypermobility can lead to that what we call heightened sympathetic tone. So we're triggering fight flight a lot because we're in pain a lot. You know, we've got dislocations, subluxations, the joints moving around, there's soft tissue damage going on all the time. And if we're hyperextending our joints and injuring ourselves, we're going to be in more pain. We're going to have a lot more kind of muscle tension. It's going to create chronic pain potentially. And it leads to that kind of stressing of that autonomic system, leading it to become more wonky as well and being triggered a lot more. Anything to add to that slide, anybody?
I think I just wanted to come in about the question about the connective tissue and the joint laxity and the nerve fibers. I think what you know, sometimes we think of the nerves as being quite big, and they are. There are lots of really big nerves in the body, but also they get finer and finer as they move through the tissues, don't they? And the importance around the link between joint hypermobility syndromes and PoTS is that, you know, those nerve fibers send flash, very quick, fast signals across the body to responses. And you've got those same sorts of nerve fibers within the heart tissue that's kind of telling the heart how fast to beat, and also controls what blood pressure does. So when you get blood pooling and you've got like this, you know, dysfunction with the way the nerve fibers are running and sending signals, and the heart senses a much lower blood volume circulating, because actually it's all going in your boots, is then it kind of triggers that response of, you know, really fast heartbeat that is the primary feature of PoTS. And it can also trigger blood pressure responses as well. And I think that's really important to understand, you know, kind of where that link lies.
Yeah, absolutely. Phil, anything to add to that one?
No, that's fine. Thank you.
Cool beans. Look at us go. Okay, so hypermobility and PoTS, just some small things to consider. Because there was this roaring success of people saying that they were bendy and they were POTSy as well at the very beginning of our presentation, this is even more important for us. So hypermobile people, absolutely, they can be misdiagnosed with a number of things. We know they can be misdiagnosed with things like fibromyalgia, although that can be there. Things like anxiety, but actually could be POTS, and things like this. But we also see a lot of things like breathing dysfunction, maybe been diagnosed as asthmatic, but actually they're just not breathing correctly. Myself included, I've actually with my GP been weaning my asthma inhalers, because I don't know if it is that, or just because of my hypermobility, I breathe really badly, and it's quite a common thing for us. We don't breathe properly because floppy is comfy, so we're leaning forward a lot and squishing our diaphragm, squishing our lungs, and then we find we get a lot of breathing dysfunction. So we breathe faster than the average bear. Triggers POTS, it triggers our fight flight system, so we're going to then be triggering our own adrenaline dumps through our body and triggering our POTS and things. And breathing exercises has been paramount to controlling my POTS, controlling that triggering. But before even that, it was knowing the difference between, is this anxiety or is this POTS, and kind of working all of that out as well. When you've got pain going on, it's very difficult. It takes a lot of practice to kind of work all of that out. So breathing exercises, however simplistic, and people probably been told this a million times, really are important. Even for people with hypermobility, learning to breathe properly from right deep down into the belly, but also do consider working with somebody on your posture, such as physio as well, because we want to be able to breathe from our bellies and have good posture. It's very important. And then we can actually reduce the amount we're triggering POTS. You know, breathing physio, it's not something I'd ever really heard of until a few years ago. Apparently it's a thing, and it's very good. And then I have clients in my practice reporting really good things with breathing physios, and they're learning to breathe correctly because of this kind of floppy posture, and it's just more comfortable that way. We do find we are squishing ourselves more and then learning to breathe right deep down into their belly, because we do find we're up here a lot as hypermobile people, and that because we've got that real, even here, we've got a lot of hypermobile and POTS people. There'll be a lot of people sitting here tonight, and the more tired you get, the more fatigued you get, the more you find yourselves kind of squishing over, and then you start breathing faster, and then you might find your POTS start triggering. So it's just little things like that to consider and bear in mind. And I've put bubble breathing down and some bubbles, purely because this is one of my favorite kind of visual things that I teach clients. There's certain breathing exercises that we do that trigger our parasympathetic nervous system the fastest. It sends the biggest the strongest signal to the brain to calm PoTS down, even just a little bit. And it is just breathing in through the nose and pretending that you're blowing a bubble. Do you remember when you was a kid, you used to do the dippy thing and then blow the bubble? It is just really slowly outwards, blowing out really slowly. Doing a few of those kinds of breaths can calm your PoTS down and just make you feel like your world is a little bit more balanced again. So hopefully that's a nice little tip for you. Just wanted to chuck that out there for you all. Anything to add on to that, anybody?
Yeah, Kim, that was great. I think one of the things that I kind of want to tease out a little bit is the difference between PoTS, anxiety, adrenaline surges kind of discussion, because there's a huge amount of invalidation, not just with PoTS, but with hypermobility syndromes, and the impact, there's a certain degree that, there's always a little bit of variations that the general population have. And then there's those extreme variations that, we see in the joint hypermobility and like in the pot when it comes to PoTS. And I think because there's a lack of knowledge and understanding out there, the awareness, I think, is getting better, but it's still not there. The science isn't there. And not to say science can always answer every question, but we just don't, the science just hasn't got the research around it. And because of that, there's a lot of dismissals, and people spend a long time, don't they? So I think, like, for everybody on the call, probably can share experience of being invalidated, isn't it, along the route?
Yeah.
I think that's one important thing just to tease out a bit. And the breathing is really important. I remember watching Boon Lim, who's a consultant in Imperial, we did a talk together many years ago, for an event, and like he was, he'd love to sit there and show you his watch, his heart rate monitor, and show that when he took really nice long deep breaths, how it just reduced his heart rate down, which is really important. PoTS, the classical feature of it is that you've got this abnormal rise when you're standing up. And that's been associated in some of this tiny research studies, because PoTS has very small research, but in a few tiny ones, that's been associated with adrenaline surges. So people will often say to you that have PoTS, sort of like, I am doing nothing. I am not panicked or worried about anything, but all of a sudden this feeling comes over me, like I've got like it's a panic attack, but I'm not panicking. And that's really the adrenergic surge at the background. And I think also the other interesting study that came to my mind as you were talking was one about, I read it. It was an older study where they tilted people and they did psychometric testing. So psychometric testing is the kind of the tools that a lot of the psychologists use when they're diagnosing things like ADHD and stuff, to like kind of get all these different markers and see if you're hitting the right scores to get sort of these diagnoses and everything. And what they did was they took a group of people with PoTS and a group of people that didn't have any PoTS, and they tilted them. And when they laid them flat, they got them to fill out questionnaires for ADHD and anxiety. And then they tilted them upright. And when they were in the upright position, so they had this big postural change, they again tested them to fill in these questionnaires around anxiety and ADHD. The interesting thing was the rates of anxiety amongst people with PoTS was no greater than the people in the healthy population. So, the idea that people with PoTS are more anxious isn't, it doesn't marry out. There are people that are anxious in the general population as in anything. But one of the very interesting things I actually found was the scores for ADHD were a lot higher when the people with PoTS, when they were upright. So I thought that was a really interesting, feature that adrenergic surge and that fast heart rate actually can make people feel quite jittery. So I think that was, sorry, I've digressed a little bit. I'll let you go on.
Not at all, not at all. But it's important that, we do talk about these things, and when we do talk about hypermobility, we have this huge link with neurodiversity as well, and we have papers on that, and we're seeing more and more of that talked about. So that does not surprise me that came up at all. Thank you. Okay, anything else to add, anybody, on this? Okay.
Just to say that anxiety is definitely a feature of the hypermobility syndromes.
Yes.
It's a big thing, and it's not surprising when you go around for years trying to get a diagnosis and people
This
aren't
is
listening
it.
to you carefully. Depression also, and you know, the variety of key symptoms, including the chronic pain, the fatigue, fibromyalgia. Fibromyalgia is closely associated with hypermobility syndromes. That's important, and that's a manifestation of central nervous system sensitization. So it's important to listen carefully to the patient, always accept the story, and then try and work out what's going on from and not dismiss what you're being told.
Yeah, absolutely. Thank you. Oh, Helen.
I was just going to say very quickly on that, Philip. I think that's a really, really good point. I did a large interview study as part of my PhD. I know all the people with PoTS just turn around, and not all of them, most of them would turn around and say, I didn't start out my journey as an anxious person, but actually I faced so many invalidations. Just going to the doctor made me anxious because I was just worried about what am I going to get when I get there.
Yes.
Well, thank you very much, everyone. That was a really interesting discussion, and it's also lovely to see all the chat going on in the box. I think, as ever, it's just heartbreaking reading the comments about what people are putting up with. Lots of comments about services closing. How do you access services? So, I think is the panel happy if we move on to the Q&A now, or is there anything further you'd like to add?
We were just going to talk about the quick reference guide. It can be done now or at the end.
We've got that at the slides at the end.
Yeah, and Link Fairy's already put the link in the chat so people can access it.
Link Fairy. Amazing.
Great work. Okay, fabulous. So we've got lots of questions coming in. Please do feel free to pop them, keep popping them into the Q&A box. If you've popped one into the chat, could you try and move it over to the Q&A box? Because otherwise I will have missed it because it won't have transferred over. And I think a good one to start on, that's probably something everybody could input into, is, are there any tips from the healthcare professionals with how to be taken seriously when trying to get diagnosed with PoTS and hypermobility syndrome? So we know that this, as we've just been alluding to, you know, it's difficult. What would people say to that?
Shall I just kick off from the doctor's perspective? I mean, the important thing is to go well prepared. And I actually provide my patients with a questionnaire, which I, in the private sector, I have the luxury of being able to send them in advance. But it's got all the relevant questions there for you to answer in relation to the hypermobility. But the important thing is get your act together in terms of what you want to say. Be clear about what you're saying. Put everything down, but in a very concise way, because you've got limited time. I mean, with one of my questionnaires, I got a response of 62 pages from one patient. That's not going to help you have a successful consultation. So be clear about what you want to get from the interview. Be aware that, you know, the average GP is not particularly well informed. You may be much more well informed than your GP, but you can help and get a good working relationship. Most people are prepared to, you know, make an effort if you come well prepared.
Thank you, Phil. I think that's great advice. I mean, there's a couple of questions in the box about, you know, any tips on being dismissed by healthcare professionals. So very similar lines. Has anybody got anything further that they'd like to add in terms of how you can go prepared, or if you feel that you've left your appointment and it's been a disaster, what action to take?
I
Little
think
things like symptom diaries. Sorry, Helen, go for it.
No, I was just going to say you can always seek second opinions, and I think, like, you know, that I think things are a lot better than they used to be, but I think you can seek second opinions. And I just want to reiterate what Philip said is, you know, the healthcare professionals often have limited time. So GP is a general practitioner. And you know, you have like 10 minutes maybe with them at most. So put down your top 3 things that you want, not absolutely everything. And same as when you go to see a clinician in the NHS, is going in with the top, is going in there with the key things that you want dealt with, because that's your time with the healthcare professional. You want to get what you want out of them. Yeah. So remember to use that time wisely.
Yeah,
Thank you,
symptom
Helen.
diaries can be quite useful for them as well, and take those with you. The thing is, I know it's such a complex, these are complex conditions, and you have, like you say, limited time. So little things like it does feel like you're herding sheep. Well, what are the most noisiest sheep that are running around? Basically, is it the pain? Is it the PoTS? You know, and which ones are the kind of the top of your list that you need to be looked at? In terms of diagnoses, I know it's difficult. I hit my head against a brick wall to get diagnosed myself. I did ask for second opinions, and I ended up with a geneticist at the end, after 2 rheumatologists. But I think there's still this misconception that anybody who is asking for a diagnosis is looking more at HEDS because they think they'll be taken more seriously, and not everybody is going to hit that criteria. And HSD is treated the same. It is cared for in the same way. It doesn't make it any less of a diagnosis. They should be absolutely treated the same way and looked after the same way. So regardless of what you're going for, you're still going to them, asking, you're wondering if you've got a heritable connective tissue disorder. And actually that is what they should be looking at, regardless of the type. That's what needs to be supported.
I think that's quite key, because we have the similar issue with, a lot of people these days have heard of PoTS, so they get referred for parts, and then actually if you talk to a lot of specialists, it's low blood pressure can be, you get the same symptoms, you can be you feel just as rubbish, it can be just as much of a problem, but somehow if you don't walk out with that specific PoTS diagnosis, it feels like a letdown or something, or feels like a disappointment. And I think that's a really difficult thing to manage. I think what you need to have actually is just somebody knows it's a problem, somebody recognizes that this is having a big impact on you, and somebody's going to be there to kind of like help guide along the path, or help guide your GP in terms of what treatment might be the better options.
Can I just say that a lot of people get a little bit of a lot of different symptoms, and for example with PoTS, it's the label of postural intolerance is very useful if you can't classify it technically as PoTS, and the same would apply, and that's where the spider comes in quite handy, because if you get people to do the spider questionnaire, you can see what the shape of the diagram comes out. So at a glance, you can actually see which are their problem areas, and which, so some people get everything to a little degree, and some people are very dominated by urinary symptoms, for example.
Yeah.
And I think, not to be cynical, but because the spider comes out of UCL and Great Ormond Street, actually, if you show it to clinicians, this should not be the case, but it has some, credibility because of where it's come from. And I think people will potentially listen. So I think it's not always, you can't go with a library of information, but if you can take some succinct information on little bits of research or studies that have been done, to leave behind afterwards, I think that's not always a bad thing. But do bear in mind that the professionals are very time starved, and as everyone said, use the time wisely. So.
Thank you.
And we've had just one thing to add on to that someone said a geneticist won't see them if you mention hypermobility. They saw me, but if they don't, it's still a connective tissue disorder, so using that as a phrase can sometimes help instead. But I know it is absolutely a postcode lottery when it comes to who will see you and where, but there are people out there that will see you, even geneticists. When I mentioned hypermobility, and they did diagnose me, so it does happen, although I know it does feel like a postcode lottery for you.
Thank you, everyone. That's really helpful answers. Just from a PoTS point of view as well, there's a GP guide, a PoTS on a page, and we always really strongly recommend people take that to their appointment, because it's just got it in very condensed information. So I'll pop the link onto that in a moment, if I can multitask. And secondly, I don't know if this was said, because I am trying to multitask and read questions and comments, but I think taking somebody to your appointment as well is just such a valuable tip, and one that's really easy to forget to do. But I just think it's so much better if you can then digest the appointment afterwards and, remember exactly what was said. So that's something that we always recommend. Okay, so moving on now. There's not going to be much order to these questions because there's so many. I'm just going to go for it. Will hypermobility show on an MRI?
In a word, no.
No.
No? Okay, that's a nice easy one.
It's a clinical, it shows on a clinical examination, and one of the important things, coming back to when we talk about the quick reference guide, is is you're looking for evidence of hypermobility either with the 5-point questionnaire, which will be made available to you, or the Baton score. The Baton score is not all embracing. There are people who are hypermobile who the Baton score doesn't show up because it's just looking at certain joints. It doesn't look at their hips or the feet, for example. But the Baton score is useful. Yeah.
Thank you very much. Would someone please explain the difference between hypermobility and Ehlers-Danlos syndrome? I appreciate they are closely related.
Go on, Phil.
Okay. Well, I mean, we need our little diagram, the Venn diagram, back again to answer this question. If you can, Kim, can we just?
I can do that.
Yeah,
for
we can.
you.
Yes, great. So the important thing is up to 10 to 30% of people in the population are hypermobile, and they have no problems at all. In fact, it's an advantage for many people. And they're on the left of this picture. Yeah, this is what you call asymptomatic hypermobility. On the right side, we've got the Ehlers-Danlos syndromes, the rare ones that can be identified by genetic testing or confirmed by genetic testing. And you very rarely need to do genetic testing in clinical practice because most people fall into the middle group, hypermobility spectrum disorders and hypermobile EDS, which is one of the forms of EDS which does not have a genetic marker, although I think progress is being made in that area. And then there are other hereditary diseases of connective tissue, including Marfan's, osteogenesis, etc., and also Down syndrome. So that's the brief answer to that question.
Okay. Thank you so much. This is an interesting one. Could you suggest how, as a healthcare professional, I could do this education work with those locally, particularly to counteract the tendency to dismiss patients? So as somebody here, as a healthcare professional, how can they try and help? Because it's obviously the more numbers you've got, the better. It's a very difficult question, I think that one is, but just interesting in terms of...
It's straightforward. On the HMSA website, we have a whole section on education, and we do a thing called a meeting in a box. And at the end of that meeting in a box, you can give people the quick reference guide, which is like your PoTS on a page equivalent for the HMSA. So all the resources you need to take including PowerPoints, take into a local group are there on the HMSA website, and it will take you through step by step.
Perfect. Thank you, Phil. I also, from a PoTS UK point of view, we've got on our YouTube channel a huge number of resources. We've got our previous masterclasses, lots and lots of webinars, but also if you were to reach out to us and, if there was something in particular you were looking for, we'd be able to signpost you, or it might be that we could provide some bespoke training to, whatever the relevant setting is. So reach out to both charities and, we'll hopefully be able to signpost you. In the right way.
Get in touch.
We can do the same.
Very best to help. We'd love to help, and we do have sort of free versions of we can give you packs of leaflets to share. We can signpost you to events, all sorts of things. So get in touch. We'd love to help.
We would love to receive more emails from healthcare professionals who are wanting to do more. That would be amazing, rather than services are closing. So please do. Where should we go now? Can you be the opposite of being bendy and actually have stiff or unstable joints, but have lots of other related symptoms, e.g. pain, dysautonomia, mental health, MCAS?
Stiff, I mean, the characteristic stiff joint condition is ankylosing spondylitis, which is one of those things where the spine becomes fused. I mean, that's a good example. People can have stiff joints in relation to various forms of arthritis, such as osteo or rheumatoid, where you'd have rheumatoid in particular, you'd have swelling, and that's exactly where you would get an answer from seeing an NHS rheumatologist. So
I think also though, as and Phil, correct me here, but people do get stiffer often as they get older. So quite often a good question to ask is, if you're a woman in your 50s, not how bendy are you now, but what could you do as a child? And I think actually, as people's profile does change over time. So it's often very relevant to look back to what you could do as a child, what's present in your family. Often we find that mums realize it when their children are diagnosed. So you can, it's always a good idea to look back to how you were when you were younger as well.
That's true. And also my first stop would maybe not be the doctor, but maybe the physiotherapist, to have a good look at all of your joints, just in case you've got tight fascia or other aspects in your joints that could be just simply freed up with some physio exercises or yoga.
Fantastic.
Yeah, it's not uncommon, especially we go perimenopause, menopause, and as the hormones are changing, we may get stiffer, but we're also seeing more people being diagnosed later in life because of the hormones having that impact on their hypermobility. But because it's the connective tissue problem, it's affecting all the other systems in terms of digestive system, but their joints are a lot stiffer. And this is again why it's important for Phil's a nice quick reference guide that we put together with the 5-point questionnaire on there, asking about that early childhood questions, because we're getting stiffer as we get older. We need to know what happened in the past, and the Baton score, which is what they're still unfortunately using a lot, isn't going to cut it to be able to diagnose you. Not when you get later on in life.
You beat me to it. So the problem with the Baton score is it doesn't test many of the joints. So it can confirm that you are hypermobile, but for example, I am mildly symptomatic. I ace the Baton score. I can get a very high score, but there are people that we support, volunteers, who are far more symptomatic, far more severely affected because it's affecting different joints. So it kind of counts you in, but it can also count you out. So it's a bit limited.
Yeah.
Thank you, everyone.
Can I just
Helen?
very quickly as well, perhaps one of the joint hypermobility experts can come in on this, is in my experience, I've always said to people when I've seen them with PoTS and sort of joint hypermobility is for a physio with a rheumatology background and understanding, because some of them have seen sort of all sorts of different physios that have very little understanding, and it's not really taken them any further forward. Is that your?
Yes, sadly that is the case. You want a physio with an interest in hypermobility, somebody who understands myofascial techniques, that's muscle and fascia mobilization techniques and muscle balance. And it's not just about what the physio can offer. There are other movement therapies which are important, like Jeannie Debon's Zebra Club Pilates type approach, and also the Alexander technique, all of which can be generally beneficial.
Thank you. Is there a correlation between PoTS and increased diastolic readings on standing but low systolic readings?
So I think so. Increased diastolic and lowered systolic.
Yeah.
So I think one, it depends on where you're getting the readings from and what sort of machine you're reading. But I think the most important thing that you're looking at is that it's sort of PoTS is a part of a spectrum of cardiovascular dysfunction, and those cardiovascular mechanisms, which are primarily heart rate and blood pressure. So on one side of the cardiovascular spectrum, you've got pure issues around heart rate controls when you in your posture. On the other side of the spectrum is pure blood pressure problems when you're standing up, dropping really low, called postural hypertension, sometimes orthostatic intolerance, a whole number of different names. And then you've got, which I actually think in clinical practice, what you see most people are on kind of like a bit of both and have like a little bit of more heart ratey and less blood pressure, or a bit more blood pressure issue than heart rate, and it will give you the same symptoms really. The diastolic, usually you get a drop in that as well as systolic, so that's why I'd question and make certain that monitoring, and I think there's always a lot of benefits of monitoring at home and things like that, but also making certain that we've got the right type of equipment that we're monitoring with and things like that.
Perfect. Thank you, Helen. We've got a couple of questions on breathing. I know we talked about that earlier. So how do I access a breathing physio or a breathing expert when the GP acted like he hadn't even heard of the GP acted like they hadn't even heard of breath training? So yeah, how do you go about finding the right person to help you with breath work?
So for a lot of postcodes, you can self-refer for physio, and then after a good discussion with that physio, they might be able to recommend or re-refer elsewhere. Phil, do you know any pathways to get to breathing physio specifically?
Well, I think it's you only have to look on the your local yoga teachers, Alexander teachers. It's all a big part of their repertoire. So it's so much mainstream. Breathing is so much mainstream. The question is finding a therapist with whom you resonate. I think that's really important. And so you may need to shop around a little bit. So I would just, it's a question of what's in your locality, and that maybe a recommendation is important. But the Alexander teachers are worth looking into, as well as, of course, physios as well.
We've also had some really good comments in the chat about that as well, and how they've been referred. But also, I mean, singing. Even if you can't sing, it's great for you.
Yes.
It's great for your autonomic system as well.
Not sure you'd say it if you could hear my voice.
There are some super helpful tips that people are sharing in the chat. So thank you, everyone.
They really are. It's great. Such a wonderful community.
PoTS UK as well throughout October have been running. I think we've done our third, so we'll be doing our fourth session, and it's yoga and breath work. It's just a very gentle introduction, but they've been absolutely lovely. They're on our YouTube channel, and I'd really advise you catch up. And it's just an introduction, and I think the message that the yoga and breath work teacher is very much passing on is to do your research, do some reading up about it and see what works for you. Another one of the questions we've had is deep breathing makes me feel more dizzy. What should I do? So I think that's a question that we get asked a lot.
Yeah, practicing any sort of belly breathing can make you quite lightheaded to start off with in particular. So just lay down, sit down when you're practicing. Don't be standing up and walking around at the same time.
I think what you said is just right key there, Kim, because often I would say to people that actually you're far better off with something like Pilates than yoga, because sometimes I think you've got to be bit pick and choosy around different types of yoga exercises and what you're doing, because all of the PoTS symptoms are orthostatic in nature, and yoga tends to be in much more of an upright position, and Pilates tends to be a lot flatter. So actually people with PoTS tend to cope a lot better with things that are floor based and on the floor. So I always think picking and choosing, and just like you just said with breathing, is I wouldn't want to practice my breathing exercise if I had PoTS standing up, because that's probably going to make it,
just a recipe for disaster. No, I would be the same. I would be on the floor gone.
I think the variability is huge, isn't it? And it's also with yoga, with some teachers who are less experienced and overextending the joints, but we also know of fantastic yoga teachers who do really focus on the breathing, who are very understanding. But Pilates is always a good option.
Yeah, I think it's important, whatever avenue you try, be it yoga, Pilates, anything, because you can do certain ones like yoga. There's chair yoga, there's all sorts of ones, there's real adaptive ones out there. So, research your instructor and research the instructors around the area. They may be PoTS friendly, they may be bendy friendly. We've had people come and talk with us that are Tai Chi and Qigong, and we were seated doing it, and it was absolutely wonderful to be able to have that experience and know I wasn't going to be a dribbly mess in the corner by the end of it. I was passed out, flat on my face. So, just research who you're looking, what you're looking at, and research the people that you want to see.
Yeah,
and
absolutely.
You can get loads of information from your community as well. People recommend people they've had a great time with, and that's a real key one, talk to your community.
And Phil's mentioned Alexander technique, and we've had sessions on constructive rest, which again is done lying down, which is again all around breathing and relaxation, but might again be a good option for people who want something that for which downward dog is probably not their best friend.
And the point of Pilates is to make sure you're not going to somebody who has a very vigorous form of Pilates. It has to be somebody who has experience with hypermobility, as it can be overwhelming for some people.
Yeah.
And that's where Jeannie de Bon's approach. She's just brought out a book, which
Yeah.
was impressed. Sorry, I shouldn't advertise this, but this is...
No, if people watch
It's
this
fine.
space, there's going to be a blog from Jeannie on our website this week. So.
Yes. So
Yes, it's very exciting.
She's brought out a book on integrated movement method for hypermobility management, and there's such a lot of useful information in there. It's got input from Alan Hakim, which will answer quite a lot of questions as well. So the question is really to find the thing that works for you and what's available locally, because not all of it is available.
I think that's so true. You may have a wonderful Tai Chi teacher locally. You might find that there's some great online singing courses that people are recommending. There's all sorts of different things, but it's,
Yeah.
I think we find with everything from clinicians to kind of self-management support, unfortunately, it's very patchy across the country, and I'm sure it's the same for PoTS as well. So
yeah.
Sorry,
Absolutely.
there's lots of people asking what's the book called and the author, please. Can you just slow yourself down there a little bit, Phil?
Jeannie de Bon, JeannieDibon, and it's called The Integral Movement Method for Hypermobility Management.
if you
I
bear
think
with
it's
us,
pre-order, isn't it?
literally, yeah, I think it's not actually out yet, but it's pre-order. There is a blog coming up about the research which is fed into the book, which will be on our website later in the week. So if you can bear with us, check back and look at our blog later in the week.
Sorry to jump the gun.
Yep.
No, it's
All right, there will be a blog drop. Don't
it's
worry.
all in the public domain. There's no secrets being shared.
Phil's just shared an exclusive, I think. Okay, so somebody's asked, who should they see first to get diagnosed? A rheumatologist who has experience in connective tissue disorders, or a geneticist?
Well, definitely somebody who has an understanding at a clinical level. Rheumatologists generally are not too wrapped up in managing inflammatory joint disease. So, for example, the British Society for Rheumatology is not hugely encouraging rheumatologists to learn about hypermobility, which is a problem in itself. But a rheumatologist is a good starting point. You don't want to start off with a geneticist. It should be, you very rarely need to see a geneticist. And on the quick reference guide, you'll find there's a box that says genetic testing, when is it indicated, and your rheumatologist will be able to take from that when they might need to see a geneticist.
But just to put it out there, all the work we're doing, your GP should be able to diagnose you. This is what the whole crux of the thing is. They should be able to diagnose you, and this is exactly why we've done the quick reference guide, to make it one page. This is your diagnosis. This is what we're trying to achieve, but we're just trying to get it out there as best we can.
And I think
and PoTS is mentioned on there as well.
Yeah.
Just so you put that.
and if you are not having luck with your GP, sometimes now you can go to the first contact physios. You can then at least have written on your medical record an observation of hypermobility, which can actually be helpful sometimes with the GP. And I know that in some areas, we've been talking to someone in Bristol who's first contact physio, who's really good at working with the physio, with the GP rather, to move people through the system and to get those referrals. So although it seems counterintuitive, sometimes actually going via the first contact physio and then back up the other way can be helpful as well.
It was podiatry or physio that first mentioned hypermobility to me, and that's what set me on my path. So yeah, they're great.
Podiatrists are also super helpful, particularly pediatrics.
Because you're like, oh, your hip shouldn't do that. Oh, okay, cool.
Thank you. Right, I'm really conscious of time. We have so many questions. We had really hoped that we would provide an update from both charities. HMSA, is there anything that you feel you would really important that you need to cover tonight? Or
no, absolutely not. It's absolutely fine. Flick has put the quick reference guide again in the
Yeah, that's the main thing
That-
from us, I
Yeah,
think.
that's the main thing from us. And just keep an eye on our website and our social media. We have lots of events, many of them are free, so do come along. We have an event that's free the third Thursday of every month, Ask the OT or Ask the Experts. The next one's on November the 20th. We've got Joy from Marcel Action coming next year. In January, we've got a hand therapist coming, so do keep an eye on those sessions. They're all free.
I'm coming
And
as
I'm coming
well.
to you, and we're kicking off and we're ending the year with the best possible way, because Kim will be there with Joe. So, and Kim and Joe run our Living Well sessions each year in January, which is a series of 5 weeks running through a lot of different ways that you can help to self-manage. So
Brilliant. Thank you so much. And we'll share your, and in the follow-up email to everybody that registered, we'll share the links to those things. It probably will take us a few days to get all the information together, but we will get that all out to you and we'll share it on our social media as well. I think from a PoTS UK point of view, it is busier, quite simply busier than I have ever known it. We are, and I think you're in a similar boat. And I suppose the main takeaway that I'd like to give with the Westminster debate that we've just had, and there's lots going on, is your engagement has never been more important. If we're putting out requests for surveys to be filled out, or for you to write your MP or to take action in any way, anything you can do. You might think, oh, you know, I'm just one person, but really is power in numbers. So just really encourage everyone to follow our social media, read our newsletters, and just try and get involved as much as you can, because it really is starting to make a difference and we're making inroads. We will send updates on both of the charities as to what we were going to say tonight. We will cover as many of the questions that we've got that we didn't go through in an email, but like I said, just give us a few days to do that, because there's a lot. And we're just delighted. It has been gorgeous to see so much interaction in the chat box, so many amazing suggestions, wonderful questions. And I think what I'd just like to end, well, 2 things to end on. One is make sure that any of the recommendations in the chat box, do your own research. What works for one won't work for another. So just make sure that you're doing your own research and that you're comfortable with what you're doing. Speak to a healthcare professional if you need to. And finally, now we're 3 minutes over, I'm going to get told off, is just thank you so much to our panel for giving up their evenings to do this. I think based on the numbers we've got, the questions, there's clearly such a demand and an interest. So thank you everybody for giving up your time.
Thank you to you, and thank you to everyone for coming. It's been brilliant. Thank you.
Thank you.
Wonderful.
Thank you.
Take care, everyone.
Bye.